Hi, Dad. If I'm on COBRA, do I also need to enroll in Medicare?
Yes, generally, if you're on COBRA and you become eligible for Medicare, you do need to enroll in Medicare and disenroll from COBRA. And the reason is because once you become eligible for Medicare, well, Medicare then becomes the primary payer, and that's how Medicare collaborates with COBRA. Now, if you're worried about dependents, well, those dependents that are on your COBRA insurance, well, they can stay on that COBRA for whatever that period was, that 18 to 30 months, 36-month period. But you yourself, you need to enroll in Medicare because if you missed this window, right, you missed that IEP, that initial eligibility period to enroll in Medicare when you're eligible. Well, now you have to, you subject yourself to penalties, late penalties, and not just late penalties for a few months or a year. Late penalties for the rest of your life, you'll have to pay that surcharge, those penalties. So if you're on COBRA, and it's probably going to be a lot cheaper, honestly, to enroll in Medicare, whether it's original Medicare, right, Part A, Part B, a Medicare supplement plus prescription drug coverage, or it's Medicare Advantage, Medicare Part C, whatever way you go is probably going to be a lot cheaper than that COBRA plan, that COBRA insurance policy that you were on. Now, if you like your doctors and you're worried about not having access to those doctors if you're on Medicare, well, then you would really look at original Medicare because 99, 98% of doctors do take Medicare, that type of insurance. Medicare Advantage is different, right? It's more like an HMO. It's a closed network. So if you really want to have the widest access to doctors because you like that COBRA plan, you like maybe the PPO aspect of the COBRA insurance that you had when you were a part of the employer plan, well then you look at original Medicare. Right? If you're on an HMO and you kind of like that closed network and you're worried about, premiums, you want to reduce the premiums, but you're still going to get hit on the co-pays and the co-insurance, then you would look at, right, Medicare Advantage, because that's more of a closed network. But either way it goes, if you're on COBRA and you're becoming eligible for Medicare, you have to register. You need to, in most cases, enroll in Medicare. Now, this is where folks get tripped up, right? So you have COBRA insurance because of, you lost your job. Somehow you're not working for that employer anymore. You really like the plan. So you're paying COBRA to kind of bridge you, right? So you're eligible for Medicare. You have a coworker or an old colleague that has that plan. She's still employed at the company that you were employed at, and she has a medical plan, health insurance plan, same one at the company. Well, the way that Medicare collaborates with those two different plans, one, you with COBRA, seemingly have the same insurance plan, and then the employee, your friend, who has that same employer plan, but your friend is still employed. The way that Medicare collaborates with that employer plan is very different than how Medicare is going to collaborate with your COBRA plan. So if you're talking to your friend's like, oh, I'm reaching age 65, I'm going to be eligible for Medicare, but I'm going to keep my employer plan and not enroll in Medicare. Maybe I'll don't enroll in Part A because it's premium free. And maybe they'll do, Part B as kind of a wraparound. In that case, with the employer plan, if it's a large employer plan, well, then Medicare pays secondary for your friend. Secondary for you, so your friend doesn't have to enroll in Medicare. She's still employed. You, on the other hand, on your COBRA coverage, you do have to enroll or you're going to be subject to late penalties and a host of other, potential issues, disasters. So don't listen to that friend. They're in a different situation than you because they're still employed, even though it seems like they're both the same employer plan. So if you're on COBRA, continuation coverage, and you are becoming eligible for Medicare, please do yourself a favor, in most cases, and enroll in Medicare. Part A, Part B, decide if you want to do Medicare Advantage or original Medicare, but you have to enroll because you only get one chance at a successful retirement.
I got it. That makes sense, Dad.